Or oxygenation. We really have all functions of the brain benefit from that. Improved ability to rest. Almost everybody reports an improved quality of sleep after a treatment. And something that many people don't think about, but reducing the negative impact of falls and accidents. Your body's more stable, you're less likely to fall. And as my sisters here know, our late grandmother, she was pretty healthy, but then she was a little unstable and she fell and she broke her hip and that quickly, ended her life. So we have great results across the whole spectrum. What I'd like to say in a few more minutes is that the method is completely safe. If there's any chance of injury, I wouldn't treat my children. I treated my daughter at birth and I treated my son at the age of 6 months. And so kids are really healthy. They're typical, I have a 3 and a 5-year-old now, that's how they're now. And they're typical kids, but in terms of biomechanics, they're really optimal. Since I started doing the atherosclerosis method, I saw around 10,000 patients. And what that means is, doesn't mean that my adjusting method is amazing. It just means that I saw a large variety of patients and ailments, and I have a lot of little anecdotes, basically. We treated fighter pilots, and they're the healthy people, as healthy as you can get, pretty much. And once one fighter pilot came, then they all started coming, and I asked them, I go, you're so healthy, what do you really gain out of the treatment? He says, well, I have 360 field of vision. And I know somebody might think that's impossible, but all that means is that they can see it this way, and they can see it this way. Doesn't mean they can turn the head 360. We had a patient who was a farmer who was gradually going deaf, and by the time we treated him, he was completely deaf. His hearing was restored, which is not a typical case. I had many deaf patients who didn't have a restoration of hearing, but the second thing he said was come to my wife, which I thought was very funny. And actually, I know him and his wife. We had a patient, I was in South America last week, and this is funny. I had a couple came in, a young couple, they're in IT, they worked in computers, and the man was maybe early 30s, very healthy, but very cathartic posture. And then I treated him, and then the next time I treated his wife, and I came down, he spilled his drink on his shirt. I go, what happened? So he used to drink like this. He tilted his cup too soon, and he spilled his drink. So this is something that I just couldn't imagine even happening. So his posture has changed dramatically, and his reflex of his reflective action of his hand isn't coordinated with that. I treated many high-level, I treated many people on both sides of the law, and I had a politician say he couldn't turn his head right, so I can't turn my head right, and he thought it was because of political abuse. It's kind of funny too, but when I told him he couldn't turn his head right, he said he had another explanation for it. And this is funny because everybody has an explanation for it. I used to ride motorcycles, so I thought, oh, I always look over my left shoulder, that's why I had trouble turning right. And the left forward rotation will limit typically the right rotation of the head. So, that was funny. A rally car driver. Because he really thought it was the best thing in the world, and he thought it gave him a competitive edge, and he swore he wouldn't tell anybody about it. Okay, so a lot of little anecdotes. Like I said, I treated people on both sides of the law, and if I injured them, I probably wouldn't be here talking about it. So it's completely safe. I treated patients, warlords in Central Serbia. Whole different story. I'm Croatian, so wrap your head around that. But anyway. Many amazing stories, but the story that comes to mind was a Parkinson's patient. There was a high-profile case that was televised. I went to television. He was virtually non-responsive. That's him sitting on the right. I couldn't establish any communication with him at all, and I thought I was wasting my time. After the treatment, he was chatting with us. He told us what it's like to be non-responsive. It's in Croatian anyway, it's a musical. Okay, so I'm on time. I think we have a few minutes for some questions and answers if you have it. Dr. Dooley wants to...
Yeah, I just wanted to say that several of us had this treatment yesterday. And it's pretty amazing. I we actually are on YouTube right here this morning. Three of us together. And the range of motion was amazing. The improvement in the range of motion was absolutely incredible. I couldn't do this, and I slept so well last night, and I'm actually walking differently, and I've never endorsed really anything like this, but I got to tell you, it's a pretty amazing technique.
Thank you.
I chronically have just tightness in my back. I do yoga or Pilates probably for like 20 years. And so we did this yesterday, and now it seems like everything's just opened up. I can move forward in motion. It is amazing. You feel like lighter. Thank you.
Thank you, Leslie, for sharing. Thank you.
And I just have to say that it's, a lot of times you get, I've seen patients where they've had significant differences before and after treatment in terms of pain and posture, range of motion, and everything. But the effects of the treatment, especially if somebody's had a chronic issue, may take months and months to unravel, and they may continue to get benefit, continue to get benefit. It doesn't necessarily replace other treatments that you would do, but it'll make all your treatments work better and last longer. If somebody's had a bad whiplash injury, they may still need, other, treatments, but, it sets everything correctly, and then the body's got to learn to move in a different way. And it's so funny when you mentioned bunions, because I really haven't even thought about it. I had this done in December, and I didn't really notice a whole lot because I'm pretty healthy, although being a ballroom dancer, I appreciate the posture. I actually had to quit ballroom dancing because of bunion and pain in the foot, and I don't have that anymore. I mean, the calcification is still there, but I don't have pain in my feet at all anymore. And flat hair is going to be, I just want to say one quickly, if you want to talk to him about getting an adjustment or get the treatment, it's not really an adjustment, it's a massage. There's a sign-up sheet at the registration desk, so I just wanted to let you guys know that you have the opportunity to experience this for yourself.
Thank you, Dr. Sika. Just to expand on what Dr. Sika said, it certainly doesn't make any other amazing therapies that are offered here and elsewhere. So on the contrary, it makes them more effective. And as long as people are doing what they're doing in life, they're going to get all the help they can get. I always say that the arthroplastic method is the beginning to recover. It's not the end. It's the first step towards. It's a big first step towards getting healthy. Please.
This sounds very similar to the work done by Dr. William Boyd, a Scottish osteopathic doctor who termed the bowling ball syndrome, the malposition of the head on the atlas. And this was also researched by Dr. Jerry Tennant, who developed a 5-minute procedure using microcurrent, very similar to your work, adjusting not only the position of the skull, the muscles, but really fine-tuning the autonomic nervous system. So, and I have found, being an eye surgeon, that this procedure in some cases can cure glaucoma, drastically reduce the intraocular pressure and cure glaucoma.
Yes. So you touched on a couple of very interesting things here. The idea of adjusting the atlas has been around for 100 years, so this is nothing new, and the importance of the atlas, obviously. And there's many modalities that do that. This is the only one that structurally fatigues the muscles. There's other things like, I'm not familiar with that, Dr. Therapy, but microcurrents, for example, we'll hear about microcurrents later today. Obviously, it's a huge place in medicine and helping get better. So I didn't talk about the difference between other methods. Other than no other method claims to be long-term or permanent. This has a long-term lasting effect.
I was interested in the slides on the asymmetry in the condyles. And I've been doing a procedure like this for about 12 years. And I find that when I do this, which is similar, maybe even the same as what you're doing, that they get instant relief for their migraines. I found that once I did that we got rid of migraines right away. But my concern is for our older patients who have a lot of arthritis and also where the condyles have worn a lot and there's tremendous asymmetry. How can we help them to maintain the position once we've done
That's a great question. So the difference between the atlas prophylaxis method is really, again, it structurally fatigues the muscles completely. The procedure is not painless, so it takes a certain amount of pressure. Once the muscles regain the strength, they hold the atlas in a new position. The frequency of the vibration reduces the viscosity of the fascia, making the fascia more fluid and therefore able to take on new shape. The safety of the method there's no direct manipulation of the atlas. The atlas goes in an anatomical optimal position, and you're right, with older people, it will not be fully it will not be in the best possible position, and therefore they will not enjoy the full benefits of the full range of motion, but there'll be drastic improvement in clinical conditions and in the function of the joint.
Thank you.
Thank you. Thank you very much for all the time. Thank you very much.